We are going to assemble the RINN for the maxillary and mandibular anterior PAs, posterior PAs, and bite wing. The armamentarium that you will need include bite blocks. They come in different colors. Blue is for anterior PAs. Yellow is for posterior PAs. And red is for bite wings. In addition, you are going to need an indicator arm. So the blue prong is going to attach to the blue bite block. The blue plastic ring is then going to attach to the indicator arm. And this is going to be your RINN beam alignment device to take anterior PAs. For posterior PAs, you're going to need the yellow bite block, the indicator arm that has yellow prongs, lastly, the yellow plastic ring. For bite wings, you are going to need the red bite block, the indicator arm that has the red prongs, lastly, the red plastic ring. Before you can place the bite blocks onto the sensor, you're going to need to place a barrier on it. And to do so, you're going to place the sensor right inside the middle compartment of the sensor barrier. You're going to use your thumb to scoot the sensor all the way up. Then you're going to rip out the outer barrier. And there we have our sensor that is covered with a barrier. So this is the first demonstration on how to assemble the RINN for anterior PAs. So for our anterior projections, the sensor has to be placed vertically. The first step is to place the bite block onto the sensor. You're going to remove this plastic piece on the bite block. Place the adhesive side right onto the sensor. The next step is to attach the blue prongs. So this is the indicator arm. We're going to attach this to the bite block. Next step is to grab the blue plastic ring. We're going to attach it to the indicator arm. And the last step is to ensure that the sensor is smack down in the center of the plastic ring. This is the correct orientation for the maxillary and the mandibular anterior PAs. So for example, if we were to take a PA of teeth numbers 8 and 9, we're going to place the receptor directly behind teeth numbers 8 and 9. So the way that it goes in, it goes behind the teeth that we're trying to capture. Then Dexter is biting down on the edge of the bite block. If you were prompt to take a PA of tooth number 22, which is the lower left canine, we're not going to change the orientation of the RINN. We're simply just going to rotate it. So now the cord is facing the incisal edge. Once it goes in, what's important is that the canine is smack down in the center of the bite block. So regardless of what tooth or teeth that you have to capture on the anterior PAs, the orientation is always going to be like such. Next, we are going to assemble the RINN for the upper right and lower left posterior PAs. So always remember that the cord has to be sticking out of your patient's mouth. Do not place the cord towards the back because the patient is going to choke or either they're going to gag. So cord is always out. From there, you're going to grab your bite block. It's going to be yellow. Take off the plastic piece, and then you're going to stick the bite block onto the sensor. The bite block should be at the bottom of the sensor. Next comes the indicator arm. So yellow with yellow. So the yellow prongs is going to go into the bite block. And the indicator arm should be going in the same direction as the cord. Lastly, attach the yellow plastic ring onto the indicator arm to ensure now that the sensor is smack down in the center. So if this was a placement for the upper right premolar PAs, this would be the correct orientation. The wire is sticking out of Dexter's mouth. The indicator arm is sticking out of Dexter's mouth. The way that this is assembled is going to be exactly the same way as if we were taking posterior PAs on the lower left arch. So I'm simply just flipping it over. So if I were to take a molar PA, this would be the correct placement. So you're looking, is the cord sticking out of the patient's mouth? Is the indicator arm sticking out of the patient's mouth? Then that would be the correct orientation or assembly of the RINN. Next, as we move to the upper left, we would need to change the orientation. And by doing so, the cord is already out of the patient's mouth. We need to flip the bite block 180. We also need to flip the indicator arm to the left side of the bite block. So it's still yellow with yellow, yellow bite block, yellow prongs on the indicator arm, and then lastly, the yellow plastic ring. Last check is the sensor smack down in the center. If we were to take PAs of the upper left premolar and molar, placement would be as follows. The cord is sticking out of Dexter's mouth. The indicator arm is sticking out of the mouth. We have the plastic ring. For the molar shot, we're simply just placing it slightly back. That would be the correct placement. Premolar and molar PAs, we're simply just flipping this down. This would then be the correct orientation. We do not have to change the orientation on the bite block or either on the indicator arm. It's simply just flipping it down. So the way that the RINN is assembled for the upper right, it's going to be the same as the lower left. Again, once we move up, you do need to change the orientation of the bite block, indicator arm, and also the plastic ring. The way that the upper left is assembled is going to be exactly the same way. So you're not doing anything. Again, you're simply just flipping it down to the opposite quadrant. Lastly, bite wings. We're going to start with the premolar bite wing on the right side. The cord is sticking out of the mouth. The bite block is going to be red. Remove this plastic piece. Stick the bite block on. It needs to align with the cord and stick out of the patient's mouth. Indicator arm that has red prongs. It goes into the bite block. Lastly, the red plastic ring. Final check. Is the sensor smack down in the center of the ring? If the answer is yes, we're ready for placement. This is the only orientation that you are going to need to assemble for the right bite wings and then also the left bite wings. This concludes the video demonstration on how to assemble the RINN beam alignment devices for anterior PAs, posterior PAs, and also bite wings.